Tetanus, also known as lockjaw, is a life-threatening bacterial infection caused by Clostridium tetani, a spore-forming bacterium. The bacteria produce a potent neurotoxin called tetanospasmin that affects the nervous system, leading to severe muscle spasms and other systemic symptoms. Despite being preventable through vaccination, tetanus remains a major health concern in many parts of the world, particularly in areas where access to healthcare is limited. Causative agent. Tetanus is caused by the bacterium Clostridium tetani. This bacterium is commonly found in soil, dust, and animal feces. The spores of C. tetani can survive in these environments for long periods and can enter the body through breaks in the skin, especially when the skin is punctured or cut by contaminated objects. Once inside the body, the spores can grow and release tetanospasmin, a neurotoxin that causes the hallmark symptoms of tetanus. Pathophysiology. The pathophysiology of tetanus involves the production of tetanospasmin, a potent toxin that interferes with neurotransmission. Upon entering the body, the bacteria germinate and produce the toxin, which is absorbed into the bloodstream and transported to the nervous system. The toxin primarily affects the central nervous system, particularly the spinal cord. Tetanospasmin blocks the release of inhibitory neurotransmitters, such as gamma-aminobutyric acid, GABA, and glycin, from neurons in the spinal cord. This disruption leads to unchecked stimulation of muscles, resulting in intense and prolonged muscle contractions. The characteristic lockjaw, trismus, which is the inability to open the mouth due to jaw muscle spasms, is one of the first signs of tetanus. In severe cases, muscle spasms can affect the diaphragm, leading to respiratory failure, and can result in death if not treated promptly. Symptoms. The symptoms of tetanus typically appear 3 to 21 days after exposure to the bacteria. The severity and progression of the symptoms depend on the amount of toxin introduced and the individual's immune response. Common symptoms include 1. Early signs. Trismus, lockjaw. The first sign of tetanus is often difficulty in opening the mouth due to jaw muscle spasms. Muscle rigidity and spasms, painful, involuntary muscle contractions can occur in the neck, back, and abdomen. Difficulty swallowing, dysphagia, and a sore throat due to muscle stiffness in the throat area. 2. Progression. Opisthotonos, a condition where the body arches backward due to severe muscle spasms. Generalized muscle spasms. These spasms can affect the entire body, including the chest and respiratory muscles, leading to difficulty breathing and aspiration. Sweating and tachycardia. Excessive sweating and rapid heart rate, tachycardia, are common due to autonomic nervous system dysfunction. 3. Severe cases. Respiratory complications. The spasms can affect the diaphragm, impairing breathing, and potentially leading to respiratory failure, which can be fatal. Cardiac arrhythmias. Severe muscle spasms and autonomic dysfunction can also affect the heart, causing arrhythmias and hypertension. Diagnosis. Diagnosis of tetanus is primarily clinical. There is no single test for tetanus, so doctors rely on the patient's history of potential exposure, such as a wound or injury, symptoms, like lockjaw and muscle rigidity, and physical examination. Blood tests or cultures may not always reveal the presence of Clostridium tetani, but they may help rule out other causes of similar symptoms. In some cases, imaging studies may be conducted to rule out other conditions, but diagnosis is generally straightforward based on symptoms and medical history. Treatment. Tetanus is a medical emergency, and immediate treatment is essential. Treatment involves 1. Wound care. Thorough cleaning and debridement of the wound site to remove any potential source of bacteria and to reduce the risk of further infection. 2. Antitoxin therapy. The administration of tetanus immune globulin, TIG, a preparation of antibodies to neutralize the tetanospasmin toxin, is crucial to reduce the severity of the disease. TIG is typically given intramuscularly or intravenously. 3. Antibiotics. Antibiotics like metronidazole or penicillin may be given to eradicate the bacteria from the body. However, they do not neutralize the toxin and are used mainly to prevent further bacterial growth. 4. Muscle relaxants and sedation. Drugs such as diazepam, a benzodiazepine, are used to manage muscle spasms and to provide sedation. In severe cases, paralysis may be induced to prevent injury from uncontrollable spasms. 5. Supportive care. Patients with tetanus often require intensive care to manage respiratory failure, cardiac arrhythmias, and other complications. Mechanical ventilation may be necessary for those with severe respiratory muscle spasms. 6. Tetanus vaccination. The most important step in preventing the recurrence of tetanus is the administration of a tetanus booster shot, DT or TD, as soon as the patient stabilizes. This can help boost immunity against the toxin. Prevention. Prevention of tetanus is mainly achieved through vaccination and proper wound care. The key preventive measures include: 1. Vaccination. The tetanus vaccine, typically given as part of the combination vaccine, DTP, DTaP, or TD, is highly effective. It is administered in childhood with booster doses every 10 years for adults. The vaccine protects against the toxin produced by Clostridium tetani. 2. Proper wound care. Proper cleaning and disinfection of wounds, particularly deep or puncture wounds, can help prevent infection. If a person has not had a tetanus shot in the past 10 years and sustains a significant wound, a tetanus booster is recommended. Epidemiology. Tetanus is rare in developed countries due to widespread vaccination, but it remains a significant health issue in developing regions, particularly in rural areas with limited access to healthcare. According to the World Health Organization, WHO, the majority of cases of tetanus are seen in neonates, newborns, in areas with low vaccination coverage, often due to unsterile umbilical cord care or lack of maternal immunization. Adult cases, especially in those with poor access to healthcare or inadequate immunization history, are also common in these regions. In the United States and other developed countries, the incidence of tetanus has significantly decreased due to vaccination programs and improved wound care. However, isolated cases still occur, particularly among the elderly or those who have not received recent tetanus boosters. Prognosis. The prognosis of tetanus depends on several factors, including the severity of the disease, the speed of treatment, and the patient's overall health. With appropriate medical care, many people recover from tetanus, although the recovery period can be long, and rehabilitation for muscle function may be necessary. However, without treatment, tetanus can lead to death due to respiratory failure, cardiac arrhythmias, or other complications. Conclusion. Tetanus is a preventable, but still potentially fatal disease that primarily affects the nervous system, leading to painful and debilitating muscle spasms. Its prevention through vaccination is highly effective, and early treatment with antitoxin and supportive care can greatly improve outcomes. It is essential for individuals to stay up to date with their tetanus vaccinations and to seek immediate medical attention if they sustain a significant wound to prevent this deadly infection. While tetanus is rare in developed countries, continued vigilance is necessary, especially in underserved areas where access to medical care and vaccines may be limited.